Next on Primary Care, Black Health and the Church, exploring the church's role in addressing disparities and promoting health.
This is where the church, I think, has an advantage because it is a trusted institution by many. Not by all, but by many.
Hello and welcome to Primary Care, the show dedicated to improving the health of African Americans. I'm Dr. Lonnie Joe. Churches are a driving force in improving health in the Black community. We believe in our church, we believe in our congregation. They are also trusted institutions that provide health services, education, and support and address health disparities. Pastors also play a vital role in leading their churches toward better health. Their voices help drive church-based health programs that support their congregations and communities. One of those leaders is with us today. We're so happy to have with us Bishop Edgar Vann, Senior Pastor of 2nd Ebenezer Baptist Church in Detroit. Bishop Vann puts faith into action, breaking barriers, building partnerships, and working inside the church and the community to improve health. Bishop Vann, welcome to the show. We are honored.
I am so honored to be here with you, Dr. Joe.
Thank you.
We've known each other a long time. Families, etc.
Absolutely.
So it's a pleasure to be with you.
Absolutely. Good. Thank you for making the time to be with us today. We have a church community here that has been around all of our lives and is an integral part of what any people, Black or white, do in the Detroit area. When it comes to health, what role do you see the church playing as an institution that can elevate the health status of the community?
Well, I just think that our faith ought to be holistic. And when we stop to think about that, Jesus said, I came that you may have life and that you might have it more abundantly. That is every facet of life. He did not say, I came that you may have church.
Absolutely.
He said, I came that you may have life and that you might have that more abundantly. Certainly you can't be in abundant life and bad health. And so it's important, I think, for the church to also to teach, to inculcate, but also to model as much as possible what health and life is really all about, and provide pathways toward better health for our constituents and the community at large.
If you go back in history far enough, you'll see that the hospital was born out of the side door of the church.
Well, actually, all of our institutions came out, our colleges and universities, our trade unions, our credit unions, etc., and of course our health facilities all had their genesis in the church.
And so how does the church actually portray this, not just to the congregation, but to the community as a whole?
Well, the church, I know that what we do is we keep our doors open. We open our doors to the community, not just for worship services or not just on Sunday or on a weekday night, but we're always open. We have a health hub at our church that we've had for the last 5-6 years that is community-based, but is led by our church. And so it reaches into the community. We were very instrumental during COVID, and also instrumental now in terms of raising the quality of life and health for people in our community.
What are some challenges that you see? Because we have a lot of activity concerning health as a whole. We're also beginning to see more activity concerning congregations as a whole in the city as it surrounds or involves health. What challenges do you see in raising that bar, raising that level of understanding of what actually should be happening in the church community? And also, how do we talk about access and where parishioners can actually get services?
We have to rise above age-old traditional stigmas about health. People, hey, I don't want anybody in my business. I don't want anybody telling me what to do. We are inherently a bit distrustful, as you well know, with regard to doctors and medicines and hospitals and procedures.
I have patients, Pastor, who will tell the pastor something about their health that they will never tell me.
Oh, absolutely.
Right.
So it has to do with trust.
Yes.
Trust is, and this is where the church, I think, has an advantage because it is a trusted institution by many, not by all, but by many. Certainly there's an opportunity, I believe, for the church to leverage that trust for the betterment of our people.
How are you dealing with the challenges most recently? I mean, coming through the COVID pandemic and a lot of the economic challenges that parishioners continue to have, especially with the challenges that we face in healthcare. It's becoming harder to meet the needs of patients. It's got to be harder to meet the needs of parishioners also.
Absolutely, because parishioners come to church with all of their problems.
Exactly.
Not just their spiritual issues, but they come to church with all kinds of needs, whether it's counseling, whether it's coaching, whether it's education, whether it's economic, whether it's family intervention that's needed, whether it's mental health, for example. Behavioral health is a big deal because we're seeing this on a regular basis in our churches and in the families that are part of our church. So the challenges are great, and this is all the reason why churches ought to be involved.
Your father was a pastor. You've done this for many years now. There's got to be a series of roller coaster type emotions to deal with one issue to the next issue in the role that you have. My father was a pastor. He would go from getting somebody out of jail on Thursday night to, going to a banquet on Friday night and, a funeral on Saturday morning and a wedding on Saturday afternoon and a christening on Sunday morning, all within the span of 96 hours. That roller coaster of emotion was there in his role, which is one reason it takes a special person to do this. The average person could not survive under these kind of constraints. How do you deal with all this? Because you've got a lot on your plate.
Well, just as there is for medical professionals, I think that there's a call. I think there's also a grace.
Okay.
So you, as a doctor, and doctors in general, have a call, making call after call after call, seeing people in different kinds of circumstances. And sometimes you can save someone and sometimes you can't. So you go through the regular ups and downs of everyday life as well, dealing with multiple issues.
Correct.
And but there's a call to be a doctor. There's a grace that's added to give you the extra strength that you need and the acuity of mind and spirit to be able to do it.
So are you saying grace is sufficient?
It is sufficient. It gives you that advantage that you need. Everybody can't do what you do, and everybody can't do what I do.
Absolutely. Good. The reason I asked that is because you consented to talk a little bit about your personal situation. And 10 to 12 years ago, you had a healthcare issue, a healthcare event. Will you talk about that a little bit and how you got through it? I'm sure it's going to be inspiring to viewers.
Yes, I had finished a service, a New Year's service, and after that New Year's service, I was about to dismiss, and we had a tremendous crowd on that particular night, and I had heart attack, or sometimes known as sudden death syndrome, right there in front of the congregation in the sanctuary at that particular time. And it just so happened, of course, that we have trained professionals in the church. So we have an emergency medical response team that is present in every service. These are people who are RNs and above. And one of the ladies who was a part of that did the CPR on me. And along with, of course, the grace that was over my life that particular night saved my life. And so I have personally been a recipient of that grace myself.
What did you do differently after that? I mean, that's a life-changing event. I mean, all of us have had our experiences to some degree, and if you haven't had one, you're gonna have one, and you know somebody in your family that's gonna have one. How did that change your perspective on health?
I think that it had a profound effect on me in every area, spiritually as well, because all of the things that I've been preaching about came alive.
We're right there before you.
Were right there before me, and I reached for the same kind of miracle-working power that I had always preached about, and God made it available to me in my time of need. So then you begin to think differently, you live differently. You can't go through an experience like that and not glean something from it.
Absolutely.
Something different is going to happen to you. Sometimes it's inexplicable. You're not in a position to fully describe it to someone who has not had that experience. But you know, deep down inside, that something is different. You have to live life differently. You, from that particular point, you live life differently, whether it's diet, whether it's exercise, whether it's just awareness. You're just more careful about life, and your sense of appreciation for life and life circumstances is a whole lot different, because you begin to understand just what happens and why every day matters.
Has this made a difference in the ministry itself?
Oh yeah. I mean, this was a completely transparent moment in front of my entire congregation. So it had a profound effect on all of them, and continues to, because they see me, you know, operating and doing my duties and being who I am, and they can look and say, I know, I was there, and that means a lot.
That kind of awareness should not only be just for, you know, an experience for the person that went through it, but how many people saw your recovery, saw the way that you have handled this? How many lives did you touch after that? I mean, just because of that one experience. I mean, that has to be a number that you probably can't number at this point.
Well, of course, we've been into the thousands. I mean, especially as the story is related to others, as they hear the narrative of it. It's certainly something that those who were there will never forget. And so I'm sure it is recounted over and over and over again.
Oh, it's still being talked about, believe me.
Yes, sir.
Bishop, you touched on it a little bit earlier about a church health ministry and how it was invaluable almost in being present at Second Ebb when you had that unfortunate event. What does operating a health ministry entail? We're sure it's got to be more than just an idea. It's got to be some input, some cooperation amongst different segments to make something like that work. Tell us about how you've developed that.
Well, the one of the greatest ways to do it is to raise the consciousness level of the people, so that they understand the need for it. You know, traditionally in our churches, we had what we called a nurses' guild. It was really just
somebody give you some tissue when you get overcome or something.
Or it was a fundraising sometimes entity where people wore very fancy nurses, old-time nurse uniforms, white stockings, and this and
you
that.
Must be over 50.
And I'm not way over 50, and they would throw the cape over their shoulder and all that kind of stuff, and couldn't help anybody.
Okay.
I got rid of that. I did not want that, because to me it served no purpose. I wanted to have real professionals there who could help meet the needs of people in an emergency situation. And you know, at first, you know, that's quite a paradigm shift, because there were those who
got some pushback.
Yes, of course. Pushing forward, I mean, everything rises and falls on leadership. So I had to make sure that I made that decision and move forward with it. And not only has it saved my life, but it saved the life of others. And then it again inculcates a different kind of a narrative in the congregation itself, that we are looking out, we are concerned about your well-being beyond just the spiritual side. And so that was very important as well. And again, when we went through COVID, we were one of the first community sites chosen by the city's administration to house the COVID vaccines. And so we had thousands of people coming through each week for COVID vaccines. And during that particular time, of course, we saw where we couldn't have funerals. There was an emotional toll on families. There was a physical toll. Many of them never got a chance to say goodbye to their loved ones, etc. So we began to expand the health hub to not just deal with some of the rudimentary health issues, but to also expand our footprint in terms of a more holistic understanding of health.
How many people are involved at Second Ebenezer now in the health ministry?
About 20 people.
Okay.
About 20 people are involved, and then we've got, people who are, again, medical professionals in their own right.
And I'm sure that there are resources supported by the church for this, which a lot of people don't understand sometimes, that, we can have good ideas, but we have to support those ideas properly.
Absolutely. And so, it's funny how people believe that, have these erroneous beliefs about where church donations go to, but it helps to fund our health hub, along with us being able to reach out into the community for other philanthropic type dollars that can also assist us in that process.
Right. These kind of activities show that you can do it.
Absolutely. It can be done. Where there's a vision, and if you don't have one, you know what happens. People perish.
Yeah, blind leading the blind is a real statement. Here again, you've done it with a good measure of success. Has this spread across the church community in Detroit?
I do know that there are other churches who have caught on to this and find it to be helpful. Perhaps, and it may not be where every particular church can do it on the same level, but to have the awareness, just to have the proper information there, not misinformation, not disinformation, but real information for your constituents to be able to be referred to or to hook up with credible health resources, I think is important.
Okay. So you're currently on the board at Henry Ford Healthcare Systems, which has been around this community forever. How do you find that kind of involvement with a major healthcare system here in Detroit, which really has a mission to support the community in its efforts, especially the religious community? How do you find that relationship progressing in terms of their corporate neighbor actually being able to make a difference in outcomes, which is what we do. At church, we want outcomes. We want people to do better. We want them to live better. We want them to have a different outcome after death. And in medicine, we do the same thing. We want outcomes-based medicine. We've got to have outcomes-based administration, outcomes-based accounting. You know, how is that working in terms of that conversation? We know that you've had these kind of relationships for a while.
Well, yes, I've been on the Henry Ford Health System board over 20 years, and probably one of the longest serving persons there. And my role, and I'm also chair of the Community Health Leadership Council, which is a subset of the board as well. So I think that my role there is very critical, and I take it very humbly, but to have the community at the table, to have someone who understands a profit and loss statement, who understands the high finance of a healthcare system, which now has 50,000 employees and 550 sites throughout the state, but also to be able to have the wherewithal to walk among those in the community and to assuage them. So I look at my role as being a liaison between the boardroom and the street, where I'm in a position to bring the two together to effectuate better health outcomes in our community.
So on our end, we're looking at the high blood pressure, the diabetes, the cancer, the strokes, everything involved, the myocardial infarctions that unfortunately occur. You see a real connection between the disparity that exists in the city of Detroit, and as it relates to the input and the collaboration with the healthcare system like Henry Ford?
Absolutely, because much of what we as a people suffer is poverty induced, poverty related often. The book that I read says that people are destroyed because of lack of knowledge. And I think that it's important for us to be able to disseminate that kind of knowledge and intelligence to our people, connecting them to the right healthcare resources, and then, of course, waiting for better outcomes.
One of the embarrassing lack of services that we have in this community is mental health. A lot of times, people want to push that kind of involvement off on someone else, and a lot of times churches get involved. We need to understand better the role of the church in this arena, because right now, 100 years ago, everybody had somebody crazy in their family. We just didn't talk about it, okay? Now it is a issue that commands not only attention, but significant resources, and also needs to have the support of a community-wide approach that can benefit that population of people. Right now, if you go down to Wayne County Jail, the jail is full of people who are homeless, and half of them have mental health needs because it's cold. But by 12 o'clock, they're all back out on the streets with basically no services, no follow-up, no follow-through, no input, or very little. How can the church get involved in that kind of approach? And I'm not sitting here saying that I think that the church needs to be everything to everybody. It could be, but at the same time, we have a real issue in this arena. Does the church have a role in addressing some of this?
Absolutely. I think that our role is a collaborative role. I think I don't know that one of these particular entities or disciplines can take care of the entire problem.
Exactly. This is not a one church job, is it?
Well, it's not a one church job. It's not a one hospital job.
Absolutely.
It's not a one health professional job. Mm-hmm. Because all of this stuff is interrelated. Mm-hmm. I mean, people have family issues, or they have transportation issues, or they have, again, poverty-induced issues, which, as we call them so famously, social determinants of health, these are the kinds of things that help to color and many times cloud the outcomes that we're seeking. And so it's going to take all of us to make that, to turn that around, because the problems are so great, and they can be consuming for one particular entity to take full responsibility for, because all of this is interconnected.
Right. And if we're not careful, even with the best of our intentions, we fail if we don't have the collaborative approach that you're talking about. This heavy lifting has to be the burden of multiple locations around a community like this to push and lift in the same direction in order to get a positive outcome. The church is so important in this regard, because we believe in the physical and mental health and the spiritual health also of the people who sit in those pews every Sunday. It seems like we've got the right combination to get us out of some of this stuff.
Yeah, we really do. If we can get partners working together, if we can get awareness working together, if we can unify, if we can control ourselves, we can control our destiny. If we can work together and understand that all of us play a role in the betterment of our community, I think we begin to make progress.
Good. I left out financial and economic health on purpose, because I know that's one of the things that you stress and address over at Second Ebenezer. Tell us about, your thoughts on that, because let's face a couple things. The community still starves from a lot of access, not just in healthcare. I mean, we've got enough churches. Okay, I would say, okay. But when we start talking about the economic progress of the community, it just is lagged so far behind. it's almost invisible. But here again, we know that that's one of the things that you're involved in terms of what the future looks like. Tell us about your thoughts in terms of economic development in the city of Detroit.
Well, economic development is extremely important. For the last 35 years or so, I've built housing. I've been very actively engaged through one of our entities, helping to rebuild and to reshape the community itself from a physical standpoint. But we find that all of these other ancillary services and resources are needed in order to enhance quality of life. You can put a person in a brand new home or a brand new building, but the quality of life
Doesn't change.
Does not change
Right.
until a mindset change, until there is a consciousness raised. And so I think that churches have a great deal to do with that, especially if their ministry is designed to have that as a goal and a purpose in mind. Now, I'm not saying that every ministry feels that way, thinks that way, or operates that way. I've chosen to do that because I figure that that's the call that's on my life and the call that's on the life of our church.
There are variations on this theme, but they all need to be pushing in the same direction in order for us to change some of the complex issues that we have to deal with. I personally, Bishop, believe that the church has the answer for all of these ills that we deal with today. We've just got to begin to work in the right direction to get the proper outcomes that we need to discuss a lot of the other issues, such as the political climate even. I have no other source but biblical to talk about politics. Okay?
Well, the political climate brings to us a sense of urgency. I mean, I think that historically for our people, you and I can look back on a time where everything emanated out of the church, the freedom schools.
Exactly.
The Montgomery bus boycott. I mean, all these things were church related. The civil rights movement itself was birthed out of the church.
Exactly.
So we know that the church is an engine. Actually, it's the only thing that we really own, lock, stock, and barrel. And so it's an opportunity for us to use it for good and for the aggrandizement of our people.
Historically, African American physicians in this country were civil rights leaders first and doctors second. And I think we've gotten some disconnect along the way in those areas that say, boy, what are we really supposed to be doing with the grace that we've been supplied with to actually speak on these issues, to not only just speak on them, but to be visible on these issues also. I think we've just got a lot of work to do. I think in order for us to speak truth to power properly, we have to speak truth to each other first. And if we can't do that successfully, I think we're going to continue to struggle with this. I'm just happy to see that the kind of leadership that you bring to these kind of issues historically is going to certainly be on the side of right, as they say. And so happy to see that we can count on Second Ave here in the city of Detroit.
Well, thank you so very much. I really believe that we ought to be looking inward, especially now in this particular political climate. You can speak truth to power. I don't know who's listening.
That's right.
I think we need to speak truth to ourselves. What we need to understand is that if we can come together, then there's no one who can stop us.
Yeah, Corinthians, we're going to look in that glass darkly and
that's right.
See face to face. Very good. And Bishop Vann, thank you so much. This has been outstanding. We're so proud to have you with us on the show today. We will do this again. Thank you so much for coming.
It's been my honor and privilege.
Thank you so much. Our guest today has been Bishop Edgar Vann, Senior Pastor of Second Ebenezer Baptist Church in Detroit. The Black Church and Black doctors share a history of fighting for better health for many, many years. The time is now for us to reconnect, to tackle health disparities and improve outcomes, and eventually save lives. For Primary Care, I'm Dr. Lonnie Joe.